Okay, so thanks everybody for being here so bright and early. Our first panel is on the Pain Education Toolkit. As a lot of you know, I think, pain has long been a pillar of this conference. It started out, this conference, as a small group of providers, mostly physicians in Southern Oregon and a couple of social workers talking about how to prescribe more safely back in about 2009 in the Rogue Valley. But it was pretty quick for that group to recognize that if they were really going to address the fundamentals of this issue, they needed to address pain. Because the pain that drives not only prescription opioid use, but much of the trauma that results in SUD and dependence on narcotics, we're never going to get there unless we address better ways to approach pain. And the Pain Guidance Toolkit has been an enormous, patient toolkit rather, has been an enormous part of the solutions that Dr. Kat Bust and Mark Stevens and others have been working on for a long time. So without further ado, I'll hand it over to longtime veterans of the conference, Kat and Mark, and let you guys lead us through the panel. Thank you.
Okay. Well, good morning again. So I hope everybody's having a pleasant evening and had an enjoyable time getting together. Isn't it so nice to be in person? Isn't it wonderful? What a pleasure. What a pleasure. So, well, I'm going to tell you about the Pain Education Toolkit. It's resources that we have for you to be able to use with your patients with chronic pain. So in this talk, we're going to talk about what is it? What is this toolkit? What are the components and things? Where to find it? And just a heads up. So at one part in my talk here, we're going to do a demo here. And at the end of that demo, this short video, there's going to be a QR code. And I want you all to be ready with your phones when that QR code, because that's how you find it. And if you have it on your phone, you're going to be able to find it again. Okay? So just get ready when we get to that part. So I'm going to talk about what it is, where to find it, and then we have three examples, three providers and patients who have used the toolkit, and you're going to hear about how they've done it, and hopefully that gives you some ideas about, let's see, I do my thing here. So I'm Mark Stevens, and I'm one of the people involved in doing the Pain Education Toolkit, but there are many people, and you'll hear a little bit about that later on in the talk. And then you're going to hear from Kat and her patient, Danielle, wonderful ladies, both. And then Karen, who was the first one to do a pain education group visit. And then Jason and his wonderful program at Richmond Clinic. So I want to start with a couple of questions here. I want to see by raise of hands how many of you in the audience are working with people with chronic pain. Raise your hands if you, so what do we got? We got about, I would say close to 50%. Thank you. Thank you for doing that. Working with people with chronic pain can be very challenging for the patients for sure, and for the providers. Sometimes we run out of things we can do, run out of things we can offer to patients, etc. And we're hopefully going to help you with that with the Pain Education Toolkit. So again, raise of hands. How many of you would like additional resources to use with your patients that you work with chronic pain? How many would you like additional resources? Yes, yes. Okay, we have something for you then. So the Pain Education Toolkit is 8 different modules. You'll hear a little bit more about that for people suffering with chronic pain. And we have a corresponding set of modules for clinicians. So set of modules for patients, set of modules for clinicians, so that you're on the same page. You hear it from your clinical perspective, patients hear it from their educational modules. And it's important that we are speaking the same language, the clinicians and patients. And that's what the toolkit helps us achieve, speaking a common language. The toolkit started some years ago, and when we did the educational modules, we put them together into a course. So let's go on to. So it actually started a long time ago, 5 years ago. We developed a Pain Education Toolkit modules, and we put them into a CME course, which was required by all clinicians to take in order to renew their license. How many of you remember taking the Changing a Conversation course? How many of you remember doing that course? Okay. Well, in the state of Oregon, 140,000 people took that course, completed that course. And at that point, I thought, eureka. You know, we've given all these resources out to folks, et cetera. But we had some challenges, COVID, you might remember COVID, and staffing shortages. And so it was a bad time to be doing any sort of process improvement, implementing any program like this. But it's now changed. This year, 2025, we've made some major changes to where the toolkit is. It was started out with Oregon Pain Guidance. That's where we hosted it on that website. And then we started collaborating with clinicians in Washington. And so we said, we need to change this. And so we changed it to Northwest Pain Guidance. And we'll be incorporating other states involved in that project. And another fantastic news we have is we got a grant. We got a grant to take the program that Jason and his team have developed at the Richmond Clinic, and we're going to replicate that program in 4 other clinics over a 2-year period. And if that works, it means it can be replicated any place. And so we've all built on what we've done over the years and things, but Jason, taking advice, not advice, but learning from what the tribe did, et cetera, has come up with a model that works, and we want to see if that can be replicated in 4 clinics, and if it works in 4 clinics, it can work any place. So we're super excited about that project. We're already starting on that. The other thing I'd like to do here is call out some of the people who are instrumental in making the toolkit the success it is today. And I'd like to start with Dwight, because this conference has helped a lot in terms of making the toolkit available, people knowing about it and using it. And so you're going to hear, for example, from Karen how that was instrumental in her using it. And so this conference helps enormously. And when we finish this presentation, I know a lot of you are going to be going out and using the toolkit. And so, again, this conference is instrumental in making this successful. So thanks, Dwight. So the people involved in developing the toolkit, there were 6 clinical experts. And one of the ladies here is one of those experts. And that team worked together for 18 months, putting together the Pain Education Tool. Massive, massive exercise. But I think you'll see from the materials, the videos, and handouts, the quality of the work that we did. And I want to call out another person. Lisa Shields, are you in the audience someplace? Please stand up, Lisa. Please. So Lisa is critical for 2 reasons. One is she gave me money. She provided funding for 5 years for the Pain Education Toolkit, the website, the course, things like that. The other thing she did is the 2 of us went through every single line of text, script, etc. of the toolkit together, editing it. So thank you again, Lisa. Wonderful. So I'm going to have somebody else introduce the toolkit. So one of the things we spend a lot of time doing is how do you engage with the public? How do you engage with? I'm going to try to use people as opposed to patients if I can. And so we have this animation which hopefully will make it a little bit more approachable. And get your phones ready because there's a QR code at the end of this. So ready, and it'll be up there for a little bit. Actually, I have another version of it too.
Hi, I'm Dr. Flores, and I'd like to introduce you to the Pain Education Toolkit. Are you someone who has suffered for many years with chronic pain, tried different medications, had injections or other procedures to treat your pain? Yet you find that none of these treatments has given you lasting pain relief? We have some good news. We have developed some educational modules that can teach you how to reduce your pain and improve your life. They are available in multiple languages, and you can access these on your computer or smartphone. Start with understanding pain, and then choose any topic you want to learn more about. Sleep, nutrition, activity, mood, social, flare-ups, or medications. These educational modules are a set of tools you can apply to improve your life despite the pain. They are your first steps on your journey to a better life. Now, let's watch the video on understanding pain. Simply scan this QR code to begin.
Is that working for folks? Okay, so what you will see is we put a lot of time and effort into making it mobile friendly. A lot of people are on their phones these days. And so you can then navigate there, and you'll see also that it's in 4 languages there. So for those of you who still need a QR code. So what I'd like to do now is I'd like to hand this over to Kat Bust and her patient Danielle, and I think you're going to find this a fascinating story. So Kat, over to you.
Thank you. Thank you, Mark. Well, without you, we wouldn't have the toolkit, because I have to say, whew, it's hard with as us as practicing clinicians. All of us were so busy, and he kept saying, we are going to meet next week, right? We're going to meet next week. So he kept us on track. So I am Dr. Katriana Bust. I am at OHSU. I am a pain psychologist, and I've been practicing for 20 years. I was practicing for 15 years before the toolkit came out, and I have to say that my conversations with patients, it was much more helpful, because after the toolkit came out. Before there was more revolving around pain, but the toolkit really gave a framework on which to hang a lot of the conversations. I would say managing pain is about building a toolkit, and all of these different components are included in those because really it's about changing behavior more than anything else when you're looking at managing pain. We're looking at trying to help patients really improve their function and quality of life more than anything else. The other thing about it is that it's much less about what we do to the patient that's going to make a difference. It's all about self-management, and that's really, really important. So everybody's on a different timeline when it comes to changing their behaviors. I think Danielle, I introduced the toolkit after we'd already been working for several years, but it took her about 6 months before after I introduced it to her, before she started to really engage with it, which is just fine. People are on a different timeline, and that's okay. Pain education in itself, which is everything that's included in the toolkit, is evidence-based treatment for managing pain. So pain education is treatment. I think that's a really important thing. And as Mark said, it's all about us speaking the same language, which is why it's really helpful. Now, when patients start to engage in behavior change, they start to build what we call self-efficacy, or confidence in being able to manage their pain. And that's a really important outcome that we're looking for. And I think about when we're looking at changing behavior, we're planting seeds for behavior change. Some people, it'll be like right away. Other people, they'll come back 2 years later and they'll say, I remember you saying that. So it can take different amounts of time, and that's okay. So in Oregon, just a couple of examples. I use it individually. I'm working solely at home now, so it's all virtual, but you can do it in groups, which is probably the best way we're going to be able to do it in terms of upscaling and getting to more people, because there just aren't enough of us in the state to do that. So virtually in groups, in person. It can be embedded in Epic. You can give it as homework in the AVS. And one of our clinics at OHSU is requiring it for pre-surgical situations as well. So there are lots of different ways. Just think about how you might be able to use it in your own life. So with that, I wanted to transition to Danielle. Danielle is a patient I've been working with for about, well, I think we figured 7 years, something like that. And she is going to share a little bit about her story.
First off, I just want to say thank you so much for having me because this is the best opportunity I've been given. My name is Danielle. I'm 36 years old, and I was diagnosed later in life. I was born with pneumonia, and I continued to be sick continuously through elementary, high school, and it continued even throughout college. At 18, though, I realized that this was more than just a weak immune system, and this is more than just asthma. At that point, I was diagnosed with chronic pain, and between 2007 to 2011, I graduated high school. I was then introduced to opioids. I was taking the medication every single day at that point. This is when I had my first surgery. That was for endometriosis. From 2011 to 2013, I had hip surgery. I had a tear. A physical therapist at that point had asked if I heard of POTS, which is postural orthostatic tachycardia syndrome. She highly suspected I had it at that point. I had no idea what POTS was. Then they performed a tilt table test, which I was an overachiever and had results within 5 minutes. Well, 30 seconds to them, but 5 minutes to fully continue and finish. From 2013 to 2015, I met with Dr. Guggenheim. At this point, I was treated for my POTS symptoms and will be given resources and information because I didn't know where to go from there. From 2015 to 2017, during this time, I was also diagnosed with Ehlers-Danlos syndrome, mast cell activation syndrome, and I was also found that I had a spinal leak for the past 10 years. Doctors were deeming me at that point, though, complicated because I had more than just one problem. I had several, and I was getting more and more. I started at this point, I was asking questions if opioids were the best option for me, if they were doing me more harm than good, and at this point, I decided I was going to take myself off opioids because I wanted to know what the pain was like raw. I wanted to know what I was feeling, if the pain changed or if it continued the same. At that point, I noticed that my pain did not change. It was exactly the same when I was on opioids than when I was off of the opioids. And that was the biggest realization to me, that the opioids were just masking my brain to feel like it was okay. From 2001 to present now, I have understand that I have multiple conditions and that they're all intertwined in one. And as you will hear in my next slide, is the toolkit helped me navigate from 2001 and to now, and continuously does help me. I know that my needs are important, and I know that I listen to my body while also sharing that I do need to allow people to help me, and I do need to open up about it because being quiet, it doesn't really educate or help anybody else.
Okay, on to the next one. So in this beautiful slide that Danielle put together, we want to walk through each of the modules and how things might have shifted from before and after. So in the first module, which is Understanding Pain, which is the one I always have people start with, it talks about the brain's role in the experience of pain, neuroplasticity, and things that can turn up the dial on pain and make it worse, like stress or poor sleep, and things that can turn down the dial on pain. So what did you learn from this module, or what were things like before and after?
For me, understanding my pain, it was crucial because if you don't understand your pain, how do you go about treating your pain? For me, it also allowed me to accept it because at first I was like, I'm sick, but it's fine. Everything is going to stay the same and I'm just going to continue on and I'll just take it day by day. But then I realized that I don't know what's going on. I don't know what day by day is going to be like. I need to understand it so I can then not be scared of it. And so I'm more open to going forward toward it.
Right. The second module is sleep, which is probably one of the ones that people go to very, very often because sleep is disruptive for many patients who have chronic pain. And so what did you learn from the sleep module?
Well, first I learned that I was not sleeping at all. I learned that I was getting maybe 1 to 2 hours, and if that was continuous or not was hit and miss. Sometimes I would go to bed and I would lay there for over 6 hours tossing and turning, and instead of just trying to find something to help my pain, I just laid there and continued to be like, I'm going to sleep. This is going to happen. But it wasn't. So what I did was when I came to the toolkit, I decided to make a schedule for myself. And what I did was I first was like, okay, I'm going to go to bed at this time. But before bed, leading up to that, I'm going to do things that relax me, not that heighten my body and make me active or excited or even happy sometimes, because that gets me really adrenaline. And so for me, I had to find like what's going to calm me. And then after I figured that out, I now sleep 4 to 6 hours, which I'm really excited about. It also allowed my immune system to restore. It allows your body to reset. That's the biggest thing, is when you sleep, your body is resetting and you can restart your day without feeling all the massive effects from yesterday.
And it gives you more energy to do
It
things.
does.
The next module is nutrition. So the things that we eat can throw fuel on the pain and make it worse, or it can help improve. So what did you do for that module?
Nutrition for me was a big one because I figured I could just keep eating the horrible ways that I was already. I didn't think about how when you put nutrition in your body, does that give you energy? Does it support growth? Does it boost your immune system? Does it make you feel like you can be more active, more social? Because I notice if I don't eat, I'm probably not going to want to talk a lot to anybody. I'm probably not going to want to move a lot. I'm going to be kind of just in my idle mode where I'm just going to just sit there kind of. And so for me, nutrition was big. And then I also had to figure out what flares my pain up, because food is a big one. It does irritate your pain. And a lot of people sometimes don't understand that right away until it's trial and error. So for me, I had to constantly just see what was going to work for my body. And all of our bodies are different, so what works for me might not work for you.
Activity, which is the next module that Nora Stern wrote. So activity is hugely important because the body's natural tendency with pain is to guard and protect. And so people develop all sorts of interesting holding patterns, stop breathing, change their gait. So, and this module talks a lot about pacing. How is this one helpful for you?
This one was huge because I did not do anything that was considered pacing. I was more of the kind of person that was like, I'm going to do it all in the same day. And if my body breaks down, well, it better just drag with me because we're still going to keep going, because that's the kind of drive that I just have. And so for me, and I know even continuously, I'm always working still to this day to pace myself, because sometimes I want to do it all. Like being here, for example, yesterday, all the conferences, I wanted to be here from sunup to sundown. And I knew that my body was not going to be able to do it. So I was telling my partner, I said, okay, when we get to this time, you have to drag me out of here, okay? Because we got to pace myself. And so that was big. Pacing, it allows me to enjoy the activities while my body is still feeling okay. And I'm not pushing it to where I have to be in bed for 3 days. So
That's a big one. Mood is the next one. So we know that depression and anxiety can turn up the dial on pain. So how is this important for you?
this was also another big one, mostly because I didn't realize how depressed and how anxious I was. And I just kind of got to a point where I was just like, I don't want to accept this. But then I realized that I have to give myself time to grieve the life that I had. And not necessarily, I'm not saying that you have to say goodbye to your life. I'm just saying that you just have to accept it for what it is at this point. And for me, I just processed it. And then I realized that although I might not be able to do everything that I used to be able to do, in the way that I used to do it. All I have to do is change, adapt, and make it to work to my needs. And by letting other people know, they can also help me so I can adapt that, so I can continue to do what I love.
Social is the next one. I think it was the last module that we added, but I think it's hugely important because so many patients with chronic pain are very isolated. So tell us your story about that.
So when I first started to get sick, I was kind of just pushing myself and going through the motions. And I didn't tell anybody that I was really sick until I got to maybe 26. And then finally I couldn't hide it anymore because I was hiding it. At this point, I got very sick to where my friends were to the point where they're like, well, now we're kind of nervous going out with you because we don't know if we're going to have to call the emergency line or if we don't know how to help you if something goes wrong, and it makes us uncomfortable and nervous. And I was like, it makes me nervous too, don't worry. And so I started to fully cut myself off from everybody and isolate, and I didn't want to leave the house. And I think I did this for about a year, where the only people that I let see me were my mom and dad, because I was so terrified, I guess, and nervous, and I didn't know how to explain it because I didn't understand it. So how could I explain it to somebody else if I wasn't understanding it myself? From this, though, using the toolkit, this allowed me to be more open about my health. And now, anybody I meet, I'm like, hey, did you know I have POTS? Or I'm like, I have Ehlers-Danlos, I'm bendy, but don't make me show you anything because it's not safe for me. But I can educate you. So I've kind of done a full turnaround because I feel like if you just change the way you're looking at it, it's not as scary, it's not as depressing, it's not I hate to sound cheesy, but you can do what you put your mind and set your goals to. You can do it. It can happen. I know it doesn't sound like it at first, but it is definitely, definitely achievable.
But you modify and you pace yourself
Yes,
as well.
definitely.
Flare-ups is the next module, and so flare-ups are any increase in pain. What we're trying to do as much as possible in the world of pain management is to reduce, minimize the duration or the intensity of flare-ups. So how is this important?
This was important because I worked with therapists and also physical therapists as well, and they helped me modify and make plans and help put more tools in my toolkit that allowed me to help when I was in this pain, because before it was just, here, take this pill and it's going to make everything feel great. And I would do it and that would not happen. And I'd be jaded, angry, upset, confused. And so then when the toolkit was introduced to me, I was like, okay, so there's more options. I can get acupuncture, there's massage therapy. I can do physical therapy that can show me different ways to adjust and hold, and also tape different parts of my body to hold my joints in. I also have gone to hand therapy that has given me these lovely little hand braces, has allowed me to be able to hold microphones like this. I can open water bottles. It's just kind of given me more quality of life back. It's allowed me to adapt to different normal daily things.
Medications.
Medications were crucial. I have to say, though, after I came off the opioids, I was very terrified to take anything, no matter what it was. You could have said, do you want Tylenol? I would have been like, nope, I'll suffer. And then I started to work with more doctors, and meeting Elena Guggenheim changed my perspective on I can take medication and it can manage me and it can give me my quality of life back and allow me to do things that I love to do without always giving me all these side effects and damaging my body. This stuff can actually help me and it manages me. So it makes me feel better and I'm just allowed to be more me.
And this is the last question. We could talk for hours, but the last question is, would it have made a difference, or how would it have made a difference for you if your providers over those years before had had some of these tools?
It would have been night and day difference. I feel like I wouldn't have gone through the isolation process. I feel like I wouldn't have been as afraid to trust. I wouldn't have been so shut down. Because when I went through that process of coming off the opioids, my doctors literally said to me, there's nothing more we can do for you. We have offered you all our resources. And I looked at them and said, okay, this felt like a business deal. And I just kind of walked out because and at that point they said, there's nothing, so you'll have to find a new provider. And so I went on a journey to find providers that would want to handle and work with me. And I think it would have just opened my mind more if I would have had the toolkit and I would have had doctors that were open to help me beyond, and go step by step with me and guide me, because I just felt very lost.
Great. Good. So thank you very much, Danielle. And if you want to learn more,
Thank you.
if you want to learn more about the complex conditions that Danielle lives with, this is a plug for Dr. Guggenheim's talk tomorrow at 8 a.m. Hope to see you all there.
And
So
I will
with
be
that, I'm
there.
going to pass it on to Karen.
Thank you, Kat and Danielle. Thank you for your vulnerability and sharing your story, Danielle. I know that was very brave, and I really appreciate you sharing your experience. It was beautiful. My name's Karen Michelson. I'm the Health and Wellness Division CEO for the Coquille Indian Tribe. I am a pharmacist by training, and I want to tell a little bit about the Coquille Wellness Center. I'm not sure if people are familiar with the Coquille Indian Tribe or not, but the Coquille Indian Tribe has 2 wellness centers. We have one in Coos Bay, and we also have a location in Eugene. We offer primary care, behavioral health. In our Coos Bay locations, we also have a dental clinic, a pharmacy, physical therapy, and massage therapy. And in Eugene, we have an opioid treatment program. We serve Native patients in our clinics, and we also serve our communities as well. And I'm here today to share a bit about our group pain education program that we developed at the Coquille Indian Tribe. So, a few years back, I had the opportunity of attending the OPAT conference with 2 of my colleagues. One was a primary care provider, and the other was our integrated behavioral health specialist. And we attended a session together that was introducing the new Pain Toolkit, which after reviewing the session and looking at the videos and all the handouts, we left the session and we're like, this is amazing. We have been asking for these tools for ages to be able to help support our patients to be able to live more functional, high-quality lives when they're living with chronic pain. And all of a sudden, we had this toolkit and everything that we needed just right at our fingertips. But then the question became, how do we get all of this great information actually to our patients? Because the videos are a little bit lengthy, so you can't really cover them during an office visit, because office visits are only about 15 to 30 minutes. And we also didn't want to just assign people to go watch them, because we felt like we kind of lost the engagement and the lifestyle change and kind of the habit change that we really wanted to see for our patients. So we brainstormed and talked about it for a while, and from that, we developed our group pain education program. We brought together a multidisciplinary group of providers at the Coquille Wellness Center. At that time, I was pharmacist, so pharmacist, primary care, behavioral health. We also looped in our clinical services administrators from both of our clinics, our dietitian, our movement specialist, our community services team, and we also wanted to make sure that we had support from our executive leadership team, because we knew developing this program would take a lot of time, and we wanted to make sure we had their support, to which they were very supportive and happy to see us developing a program to really help improve the lives of our patients living with chronic pain. So for our program, what we did is we chose to do 1-hour sessions once a week. So each week we did one of the topics from the Pain Toolkit. And as Kat suggested, we also did them in order. We started with understanding pain because that was one of the most critical things that people needed to learn from the start. We also, as we were building self-efficacy through education with the toolkit with our patients, we also wanted our patients to have a physical toolkit that they could have all of the tools in that they needed to incorporate these lifestyle changes into their daily life. So we also developed a toolkit, and each week when people would attend sessions, they would get a new tool to put into their toolkit. And we encourage people to bring their bag back and to just keep filling their toolbox, because that's really what this process is all about. Another thing I wanted to mention is potlatch, or the spirit of giving, is one of the fundamental values of the Coquille Indian tribe. So incorporating this value of gift giving for each of our classes was another way for us to incorporate the cultural values of the Coquille Indian tribe into our program. And I'm not going to go through each of the topics, but you can see there who we had teach each of our sessions, and then the health promotional item or potlatch gift that we gave for each week. So we did understanding pain, the pain journal, sleep. We did eye pillows, water bottles. We did yoga mats and stretching bands to help incorporate all of these tools. And if anybody wants to look at the toolkit more closely, let me know. I brought a few extras for people to look at. It was also important to us when we were developing this program. We wanted this to be easy for our providers. So we tried to think about any possible barrier or hurdle that somebody would come up with to say, oh, I can't do this. And we tried to hit that head on and make sure that we took care of all of those things as easily as possible. So we made PowerPoint presentations for every one of the sessions, and we embedded the videos from the Pain Toolkit into those sessions, so they'd be very easy for any of our providers to pull up the PowerPoint, talk about confidentiality, show the video, talk about the highlights that happened. We would make sure and have Q&A at the end of each session as well. And when our behavioral health specialist was with us, she would always make sure and lead us through breathing and relaxation techniques as well. We also had patients show up 15 to 20 minutes before class, and they would do vitals with our nurse. They would also complete a PEG, and then they would set goals, and then they would follow up on their goals each week to see how they were progressing on those. So far, we've completed 2 cohorts of our group pain education program. We had 4 participants in our first group, and we had 6 participants in our second. We had intentionally kept our groups kind of small as we were learning how this process would work. But as we're preparing to do our 3rd cohort in early 26, we're planning to expand that to 10 to 12 patients. We are also planning to invite our participants from previous cohorts so that they can repeat the class. We really think there's some value in patients being able to repeat the course and hear the materials and maybe be able to connect with new people by participating in the program again. And we have an ideal vision that hopefully we'll be able to identify somebody who's gone through the program who really has a passion for this type of, doing this type of work, and that maybe we could get a peer support group. So that's our future state vision for what this is going to look like for the Coquille Indian tribe. So, I did want to talk really quickly. So we did develop this 90-day pain journal. What we did is we incorporated all of the handouts from the Pain Toolkit into the front of the journal. We also included a flare-up guide, medication list, the patient's care plan in here as well. And what this did is we wanted to encourage people to start a daily journaling habit. We set up each of the pages to reflect the elements of the toolkit, and if people want to look at this more closely after, just let me know. But we had them talk about nutrition and what had been triggering for them, what things they were thankful for, hydration, all of those kind of elements from the toolkit. And we also wanted to make sure that people just had one place they could go if they had forgotten information from the sessions, that they could just come back to their journal for that information. So overall feedback for our program was very positive. We did pre and post surveys, and everybody reported learning more during the sessions. Everybody enjoyed being part of the group. We had encouraged people to come 15 to 20 minutes before the classes started, but we started finding that all of our participants were showing up like 30 to 45 minutes before class was starting because they were really excited about the class and they were excited to be together, and they had made all of these new connections with people that they didn't know before. And so we found that to be a really unexpected but positive outcome from doing these group pain education classes. And then I also just wanted to share, so on the last class, we did a graduation party. We think it's important to celebrate success at the Coquille Indian tribe, so we had graduation balloons and plates and cupcakes. Also made sure to have apple slices and carrot sticks because we wanted to make sure we're hitting all the nutrition pieces. But our patients loved it, and so it was a really great way to celebrate, garner feedback from everybody who had participated. We're going to plan to incorporate some of that feedback into our next sessions as well, just to keep making it a better and better experience for them. So, thank you. If anyone has questions, feel free to reach out.
Thank you, Karen. Good morning. My name is Jason Croning-Roche. I'm a family doctor from the OHSU Richmond Clinic, which is an FQHC in Southeast Portland. It's really nice to be together with all of you like-minded folks. I am excited to share about our experience using the Pain Education Toolkit at our clinic. I was introduced to the toolkit 4 years ago when Mark came and presented at a provider meeting. And he was just introducing us to the tools. And I got really excited because I had become a bit disillusioned with the usual care that I was providing to folks in the 20-minute office visit. Felt like we were spending a lot of time talking about medications they'd tried, medications that weren't working anymore. And the toolkit sparked something in me that said, wait a minute, there might be a different way that we can approach this. So I started working with a behavioral health consultant in our clinic named Kristen, who's here, and we began one-on-one with patients. We were kind of tag teaming, trying to figure out if we could move through the modules with patients in a one-on-one basis. And we didn't really gain traction. There wasn't the engagement we were hoping for, and so we began dreaming of doing our own group visit model. So Kristen had a conversation with Karen and learned about what the Coquille Indian tribe were doing. And we developed our own model and began our first pain groups in 2024, so January of last year. We've now run 8 cohorts and reached over 60 patients, over 450 visits. And I'd like to tell you a little bit about the model. We call it the Life Beyond Pain group. Not because it means that you will move beyond your pain, but what is your life beyond your pain while you have it? It's a 10-week group, and we use the toolkit as the foundation, as the spine, just as Karen was describing. It's a multidisciplinary team. Myself as a co-facilitator, Kristen, behavioral health consultant, social worker, and then Charles Lev, who's an acupuncturist, also here with us today. And our model really strives to create a safe and supported place where patients can feel seen and where they can bring their full selves. We call this fondly the secret sauce of our group. And we're actually speaking at 11 in a breakout session. We'll talk about our model in detail, we'll talk about outcomes, and we'll bring a little bit of what that secret sauce feels like. So I encourage you to come if you want to get a sense of that. The model is totally financially sustainable, which is an important question to answer off the bat. I bill 99213s for all of the patients in the group. I don't need to see them independently to do that. And Kristen, as a behavioral health consultant, can bill health and behavior codes as well simultaneously to me. So there's quite a lot of billing to capture, which has been really important for the sustainability. The session outline for us in the 10 groups is basically a welcome group, then we build the middle 8 groups around the toolkit, and then we have a closing group to wrap it up. I didn't expect to be doing work in the chronic pain space. I'm a practicing family doc. I have a full spectrum clinic. I do all kinds of things, deliver babies. Chronic pain wasn't on my agenda. And yet the work of our pain group is by far the most rewarding work that I do with my patients. Holding space for them, showing up fully as myself in that group, being vulnerable. It's work that inspires me, that changes my outlook. And so I just want to share that personal anecdote because I think it's easy for us to feel tired and to not to be able to see light in this kind of work. And I just want to share that we have found some light, some real light, working with these folks, and it's been mutually rewarding on both sides. These are some rocks from our group, and we're going to share a little more at our session about why the rocks are so important to us. I had a patient in our group named Lori, and she was going to come, and last minute she couldn't, so we recorded an interview in clinic on Halloween. I don't know, do we have time to show it?
Yes.
Okay. It's about 8 minutes, and it's Lori's a really special person.
Hi, Lori.
Hi, good morning, Dr. Jason.
Thank you for joining us to chat a little about your experience in the pain group and with the toolkit.
Yes.
It's so gracious of you. And I wanted to start off by just asking you to share a little bit about your experience in the group itself.
Okay. I loved the group. I wasn't sure if I wanted to commit to going somewhere every day or, once every Wednesday. But I'm so thankful that I did. Even mornings when I wasn't sure if I wanted to get up and go, I did, and I was thankful that I went, The group, I think, was really beneficial to a lot of folks because of the different, every week we would touch on a different specific topic related to our pain journey. And then it would spark conversations between all of us, and it was a really comfortable and safe place to discuss how it's different for everybody, but what works and what doesn't.
Yeah, it was really neat to have you in the group too, as our relationship as patient and provider goes back many, many years. And then to be in a different context together.
Yeah.
And I knew that you were nervous before coming and like, what is this group really going to be about? And then just coming and getting to witness you sharing and exploring your own journey in a different way, but very different than the way that we can explore it in a 20-minute visit, one-on-one. It was really rewarding for me.
Well, it was the same. I would say the same because it's not often when a patient has their doctor there and the doctors or clinicians are making themselves vulnerable also by saying, I'm kind of stressed, or it just deepened, I think, the trust level between patient and providers. So I think it's a really cool, positive thing.
In terms of the toolkit modules, was there one module that stood out in particular?
I really enjoyed all of them. However, the flare-up module was difficult for me. Initially, in the beginning, it really helps you pinpoint your triggers, which for me are overdoing it, stress, and poor sleep. And then I also learned that my diet, my huge dairy intake is not helpful to me, as well as sugars and such. But it was difficult for me to watch. It was like a trigger in itself, I feel, watching that video, because it was just
Sounds like it brought up a lot.
Yeah.
Yeah. Yeah, it was interesting with watching the videos in a group context. I saw that dynamic play out and in many of the cohorts that we've run, because the videos, they're presenting information and everybody reacts to that in different ways.
Right.
For some it's, oh, that doesn't describe me. And for some it's, oh, I never even noticed that before. I'm gonna take that and use it.
I love
And
those.
yeah, so everybody like gets a chance to reflect, at least they're reflecting on something.
Right.
And I find it to be a sort of a potent way to have that dialogue that
Yeah,
you're describing.
definitely. Yeah, I think it just can be overwhelming to kind of lay it all out there.
Yes, exactly.
You know, it's like,
Yeah.
okay, well, this is
Yeah.
how it is, but you're not the only one, but this is how it is, man, and you know,
Yeah,
here are
yeah,
some tools to help you, but
yeah,
it was a kind of like the reality factor,
totally.
maybe.
And I actually appreciate that as a clinician too, because I don't always want to say all of that directly to a patient, you know, to you, because I know that some of that information can be hard to hear, can be a reality check. And so it's nice to use the toolkit to have almost like a third party introduce this information.
The impartial fact.
The impartial fact, which I think is good information and you know, well-founded and data-driven. But then we can all talk about that information.
Yeah.
And why it might be hard to hear or why it's just really helpful. So,
Yeah, exactly.
yeah. One other question for you about the goal setting in the modules. So at the end of every handout, it says, my short-term goal is, and encourages you to make some action steps towards a certain goal. How was that goal setting for you, and how did you use that?
I loved it. It really reinforced what I've already been trying to do and helped me organize my thoughts on that better. I am coming out of like a 5-year period of time where I rarely ever left the house, and so even just the smallest thing, like just going to the groups every week, or and I keep a daily journal where I keep track of the medications I take and what time and stuff, but I also list things I want to do or things I did accomplish. And then it can be the smallest thing, brushing your teeth or washing the dishes. And I give myself a red check mark every time I accomplish it. And that it's a big deal to me, even if it's like the smallest little thing, because those little things, they grow, right? And then you can take on more and more. And now, 2 years into getting back to a healthy state, I go swimming almost every day now, and that's it's good therapy for me, physical therapy, but also it's a stress release. It's a grounding for me to be able to go and do that. But yeah, the goals is the whole. I think that's really the key thing for folks, is if they just set and just start small, and don't be worried that you're starting small.
Yeah, you've been a great example of you had to start small because of where you were starting.
Right.
And you were really honest about where you were starting from,
Yeah.
and said, well, I don't want to stay here. And I feel like the fact that you're swimming now, despite having a lot of shoulder pain, and like, it's a testament to how far you've come. And it's been really fun to witness that.
Thank you.
Yeah.
Thank you.
Yeah. I just really appreciated your presence in the group and how you interacted with all of the participants and with the toolkit too, because it was
Yeah.
really cool to see it spark a lot in you.
Right, yes, absolutely so helpful. All the modules offered something different, where I found myself so often going, oh, that's why I feel this way after I eat a lot of sugar, or, oh, that's what that is all about, how my pain talks to my brain, and, and so that in itself made me feel more grounded or secure, I guess, because I have more knowledge.
Yes. Yes,
Yeah,
that's so cool.
yeah.
Thanks for sharing your experiences with us and with the conference.
Thank you
Yeah.
for talking with me.
Thank you to Lori.
So I think you, hello? Hello? Yeah. I think you can see the impact that this is having, not only with patients for sure, but providers as well. And so I think you're seeing, Jason, the secret sauce in action there. And it's that being at the patient level. But I have a short summary and then a call to action for this group, because I know that you guys are going to go out and make use of these resources. But sorry, just one short thing. I'd like to recognize another person. So the toolkit has been on the website, et cetera, and a lot of organizations throughout the United States are finding it. And there's one organization, Kettering Health in Ohio, and we have a guest here, if you wouldn't mind standing up. So Don. So Don and I met, about 3 months ago? And she became so excited about the toolkit, she demonstrated it to the residency, family medicine residency program. They got excited, and they're going to be one of the 4 clinics in our research study. So thank you very much for that. So in summary, now you know a lot more about the toolkit. You know where it is. It's on your phone. You can get access to it. And the toolkit has great educational resources. However, they're not effective unless some providers, you are out there making use of the toolkit. They're resources that give you something additional that you can offer to your patients who are suffering with chronic pain. And I just want you to know you've seen the impact with 2 different patients here. I know you guys can have similar impacts, and you already are, but hopefully these resources will be helpful. So here's my call to action for this group. First, invest some time. Invest some time learning about the toolkit. You know where it is now. The Understanding Pain module is 10 minutes. Sometime today, take 10 minutes and listen to the Understanding Pain video. You'll enjoy it, and you'll see it also from a patient perspective. And then after you do that, pick another topic which is relevant to you. Maybe you want to get better sleep, eat better, be more active, deal with stress, etc. Pick another topic then. Once you do that, all of us working on the Pain Education Toolkit have improved our lives in many ways because we were working through developing these modules. So then the next thing, once you're familiar then with the toolkit, pick a patient. Find a patient you think is going to be receptive to the toolkit, and have them come up with a short-term goal. First have them watch Understanding Pain, and then pick a topic. And then the most important thing is the secret sauce. You guys are the secret sauce. You're the secret sauce in taking your empathy, working, being with the patient, being in their space, and go on the journey with them. It's not a visit that you have once and then 3 months later you see them. You need to work with them with this short-term goal and go along with them on that goal, and you'll make a dramatic change in their life. So thank you very much for your attention. Hope you enjoy the Pain Education Toolkit.